All right. Thank you very much for joining me today, Lawrence. I am excited to get into our chat because, yeah, as I said to you before we start recording, I haven't had a physio on the podcast yet. So I haven't had anybody qualified to talk about pain and injury management. And of course, it's even better that you are a bodybuilder yourself. And I want to go all the way back first to 2023 when you competed last, because I know that you had a bit of a hamstring injury pop up as you're a couple of weeks out from WNBF Worlds. So obviously as a physio, but also as a human bodybuilder, you're going to have a little bit of panic set in when that happens. So I guess, like, what are some of the first things that come to mind, like, first off, as the bodybuilder, and then as the physio, when something like that happens coming into the end of the prep?
Yeah, mate, it's interesting because it was something that had actually happened to me in a previous prep before. And I think looking back, I should have learnt my lesson that obviously as a human, I'm not very robust at 5 weeks out. And in 2020, when I prepped, the same thing happened 5 weeks out, was doing my RDLs, and I twinged the hamstring back then as well. And I think in 2023, I probably took it a lot better. I was a lot more calm because I think experience just does that. You know, in any walk of life, I think that there's a great saying that experience cures anxiety. So when you've seen something before, you know how to manage it really well. But obviously, in that moment in 2023, you know, it was, I think, the 6th rep. All my warm-ups had felt perfect. My preparation was perfect. You know how it is in prep. You're dotting all the I's and all the J's and all the umlauts. You're crossing all the T's. Realistically, there shouldn't have been a reason why I got injured. And that's something I tell people all the time, is that sometimes you can be perfect and still get hurt. But obviously in the moments, like, the Lawrence, the bodybuilder, was very pissed off for a second. You know, like, you know, there's still that video of me tossing my toys a little bit because I was really angry, because I was like, why has this happened? Why now? But, you know, after a few minutes, sort of settle down, assess the situation, I still managed to get through at least some of the other work that I needed to get done that day. And as soon as I got home, I sent, you know, my coach Joey a voice message and, you know, basically just let him know what was happening. And, you know, once you calm down from that initial shock, then pretty easily the physio was able to take over and think, okay, well, this is how I need to adapt. This is how I need to adjust. And I sort of realized this is probably going to be okay. I think in the moment, it feels a lot worse because there's the theatrics that go along with it. You know, you get the sharp pop, you get the bar that hits the ground, and all of a sudden you're thinking worst case scenario. But even as soon as I stood up, I sort of realized, okay, this is not, you know, horrendous, because I know what someone with a very severe muscle injury, you know, the sort of state that they would be in, and even just being able to walk on it and still move around fairly comfortably, I was like, okay, this isn't the end of the world. But that's the interesting thing about pain, is that context is so important. So in the context of a bodybuilder who's 5 weeks out, hurting themselves while training, it's very easy to see why that the pain was very high for a second, and then once I was able to add more information to the situation, the pain came down because the level of threat in my brain was not as high.
Yeah, it makes a lot of sense. And as you're saying at the very start there, like, experience does kind of teach you a lot about these things. So if you've had a pain experience like that happen in training before, and you've survived it, and you got back in training, you're able to kind of find yourself back in a situation again. And hopefully by the time you get to that situation, like you were in 2023, you have a bit more, as I said, more context there, more information, you have a bit more understanding. I've been in similar situations myself, not like getting injured during prep, but, you know, I've done powerlifting for a number of years, and I've had a couple of back strains pop up. And definitely when you are not as aware as how your kind of thoughts and everything lead into these kind of back twinges pop up, because we're always taught that, you know, if you hurt your back, you need to protect it. You, like, your back is fragile, all these kind of things. And, like, if you get a back injury, that could be like the end, right? Like, you know, you might fucking sever your spinal cord or something like that, right? And all these kind of thoughts kind of lead into your mind. You're like, geez, am I going to be fucking paralyzed if I keep this up? You know, but, you know, I think the more I've gotten into kind of training over the years, that first back pain episode was definitely, it was not pretty. It was a couple weeks where I couldn't squat and deadlift properly, but it was more so my own fault because I kept poking and prodding the injury. Like, there was no descaling the load. It was like, okay, I hurt my back here doing squats. let me try these heavy trap bar deadlifts. Okay, they don't work. Let me try my deficit deadlifts. Like not doing any favors. But then
Yeah, that typical stubborn bodybuilder, mate.
Yeah. But then over time, like it happens a bit more, and you can learn whether that's true. Listening to physios like yourself or barbell medicine or something like that, and understanding how to like descale the intensity, descale the loading, and also just not freak out about it. Give it a little bit of time, see what you can do, and I think there's such a impact of like your thoughts and perception of what it means to be injured that's going to relate to the actual recovery process itself.
Mate, 100%. And like, I think part of my job as a physio and arguably one of the most important things that I find myself doing with, both chronic pain and an acute injury is like the power of reassurance is so significant, because if you can assess someone appropriately, make sure they haven't done anything catastrophic, make sure there's no red flags, make sure they don't need to go off for any scans or anything. If you can reassure that person in the moment that it's nothing serious, it's going to be okay, it's normal that you've got this pain right now, you just see the worry like melt off people's faces. And then interestingly, you see them move better. And once again, it comes back to the idea of the output of pain is very much correlated to the amount of threat that our brain perceives. So if someone thinks that it is really bad and they are really scared about moving, their pain is going to be higher because their perception of the threat is higher. But if you can de-threaten that a little bit and reassure them that it's safe to move, reassure them that nothing bad has happened and that they're going to be okay, you see them move better, you see them in less pain because the threat has come down. And that's just the incredible thing about pain, is that you can essentially do nothing other than reassure someone and you can see real changes, which I think is an incredible sort of testament to pain in general, but also an incredible just thing about humans, and how, important just our outlook and our perception about the situation is in terms of our final experience.
Yeah, absolutely. Like even last night, for example, we got a text from a client and he's a couple weeks out from doing Masters Worlds for powerlifting. And he said his back went on doing deadlifts. And then he sent me a video of him arching into extension and doing 170 kilos for bench press. If your back was really gone, I don't know if you'd be able to arch like that and lift that amount of load. So I was like, this has happened once or twice before. We know what to do. Let's just like maybe skip pause deadlifts later on this week. Like take an extra rest day. We are deloading next week anyway. We should be grand, because it happened a couple of weeks back and he squatted PB, like something like 260 kilos. So, and then as well, I think another thing you're kind of mentioning with regards to you being perfect during prep, the context of you even coming into that training session like means a lot. So, last time he had a back issue pop up, he was on a construction site all day, lifting loads of concrete, so that coming into one of your heavy deadlift sessions, that's going to eat away your recovery capacity. So I guess like when you are kind of reassuring somebody and you're maybe trying to deconstruct maybe why somebody picked up a nail or an injury, like an acute one in the gym, what would be some of the questions that you like ask them, or recovery variables that maybe kind of prompted to think about?
Yeah, great question, man. I think, in terms of digging into the reason why someone has gotten hurt, I think that for myself, first it's about differentiating, is this something that happened in the moment, or is this something that has just been creeping on for a period of time? And to tell you the truth, like, I don't tend to spend that much time trying to like reverse engineer exactly why someone got hurt. And the reason for that is I just don't find it overly a good, way to spend the time, because I think it very rarely changes what we do. Now, that will change a little bit if someone is representing to me with the same injury that has occurred in the same way. I think that once we do recognize that this is a bit of a pattern, I think that's when we can look at things a little bit more. But truthfully, it often doesn't tell us the reason. And the thing with pain and injury is that it is so complex, it is so multifactorial, that it's very hard to attribute a couple factors. But, if we're talking about an acute injury, I think the context is important. Is this an exercise or a load or a movement pattern that is, foreign? Because oftentimes people will get injured doing something that they're not used to. The human body is very resilient. So if we have given our tissues the chance to adapt to something, they can put up with a hell of a lot. I mean, how else do you explain like the Olympics, right? Like people shouldn't be able to do this stuff, but because they've progressed it gradually, they can. Now, a recipe for injury is, accessing a range of motion with a load at a speed or level of intensity that we're not used to. Some combination of that is basically a predictor for an acute injury because our tissues are not adapted to be able to put up with whatever we're about to do. So that often does come into it. And I think that there are times where the mechanism of injury, it can be helpful to know because it also helps to then, plan that person's rehab. Because usually if someone's hurt themselves, they're usually doing something that they like doing, especially if it's in a gym context. And if you know that someone has hurt themselves on an RDL, for example, it may just help you with, planning their return to full activity and perhaps recognizing, okay, this person has hurt themselves with a specific exercise. They might be a bit tentative in the future doing that exercise again. So I'm going to have to build up to that with them a little bit more gradually and not just throw them in the deep end. So yeah, to answer your question, mate, like does the investigator or detective work, do I find that super helpful as to trying to figure out the exact reason why? Not really. I think oftentimes when I speak to people, yes, maybe there is a particular moment in time of their injury, but often there's other factors. They could be going through a period where, like in contest prep, they're a bit depleted, their recovery is not as good as it usually is. Other times where people are holding a lot of psychological stress, we know that is a predictor for injury as well. Or, is their chronic workload just so high and that exercise may have not actually been a big driver for the injury, but it was the final straw that gave out in the context of everything else that was going on.
Yeah, I like that. And I guess it's kind of the same advice you give to somebody anyway, if they're just preparing for a training session, like to have good readiness, right? You probably tell the person, let's go, come in adequately hydrated, auto-regulate loads if you need to, auto-regulate loads based off how ready you feel when you're in the actual gym itself. Ensure you're kind of having sufficient food before you come into the gym. Make sure you're adequately slept. All these kind of different things. So like whether it's just general training readiness advice or, maybe that, as you said, the investigation of why it may have happened. But then again, as you kind of mentioned at the very, very start, you'll be doing all these things perfectly and then some things will just end up happening. And I think as well, it's like, it's one of the tougher things when I'm having conversations with clients about these things, if they do have like niggles pop up or like it's mostly like across like, I find the back is probably the hardest place to kind of go about this because the back is so complex. There's so many nerve endings there, so many different areas where along the whole spine where you can have twinges happen, and there's a want to be able to say this is what it is, this is the muscle that we need to target, and this is how we strengthen it, and it's just not as simple as that, unfortunately. And one thing I've heard from a physio that's in Ireland that he works with a lot of powerlifters, he was saying that like it doesn't really matter what it is, what the actual kind of thing is, because it's not necessarily going to change how we actually kind of tackle the actual pain, because that's what you're looking to address. Like you're trying to tackle the pain response, you're also trying to tackle like maybe some movement discrepancy or like fear for movement that they do have. And that's what's important, getting the person back into training versus being able to label what they have, because then they're going to have the label of this is what's wrong with me, I need to protect my QL, whatever the fuck it may be.
Yeah, mate, there's everything you said there. Mate, you sound like you know a lot about this more than some of the physios I come across. So that's really good that you've been able to pick up some of this stuff, because I think it's important as a coach. But you're completely right. Like if we take the low back as an example, and I think it's good to do so because low back pain is by far and away the most common musculoskeletal complaint by a long shot. So I think that in terms of what you were talking about there, you're completely right. once you rule out the nasty stuff, like big nerve injuries or, suspecting something really serious with like discs and stuff, we tend to call everything else, we use this term non-specific low back pain. And then there used to be a little bit of pushback about that where they go, oh, non-specific low back pain, that's like the doctor saying, hey, you're just sick and we don't know what it is. But the reason we do that is for a couple reasons. The one is because the tests that we use in the clinic to determine what part of the back has actually been injured are not very good, because I can press on something and it doesn't mean that exact facet joint or that exact muscle or that exact joint, it doesn't mean that that's the injured part. It just means that's the part that hurts when I'm pushing down. And the other reason is, like what you said, it doesn't change what we do, because at the end of the day, I say this to people all the time, we don't treat QLs, we don't treat L45 zygapophyseal joints, we treat people. And people move in certain ways, they have different goals, they have different functional requirements. So it's less important about focusing on the anatomy and the pathology and the injury, and more important to focus on the person, their pain, their function. And it's interesting because when we use this terminology with people, when we tell them, I think you've got a grade 2 strain at your right L3 zygapophyseal joint, that actually tends to lead to worse outcomes, as opposed to me just saying, hey Shane, I think you've strained your back, mate, and it's a bit irritated in there. Because when people hear this language about tissue damage and they hear these anatomical terms, it creates this sense that they are damaged, that they are fragile, and that in turn then affects the way that they process their pain. So that's another reason why we use a term like non-specific low back pain. It helps to de-threaten the actual episode of low back pain, and it makes people a lot more empowered. It's another reason why we don't routinely send people for imaging for the lower back, because there's another, very robust research illustrating this. People who go for lower back MRIs earlier in their treatment plan, they tend to have worse outcomes when you compare them. Not only do they end up spending more money, but they're more likely to have things like surgery and injections, and they're more likely to have a worse outcome overall. And that's independent of whether or not they actually needed the scan. So if people get sent down this highly medicalized, highly pathoanatomical way of explaining their pain, it just does not help them. And yes, sometimes it sounds a bit vague, but telling someone that they've just got a bit of a sore back, if you can explain it in a way that makes sense to them, my experience is that patients are more than happy with that, because as long as they know that it's nothing serious and that they can move safely, they don't care if it's a strain or a sprain or what part of the back it is. They just want to hear that it's going to be all right.
Yeah, I don't think anybody comes into the physio's office hoping that they'll tell them that you can't move again. I think they're coming in to be essentially told, okay, this is going to recover. Versus, as you said, having the process be over medicalized, because that it definitely turns into like, I have this condition, or I have a bad back and I can't do this exercise because I've got a bad back, and that bad back seemingly can never adapt again.
It's similar to when you have people, people in your life with medical conditions. And I mean, I say this and I'm trying to be charitable. I mean, I'm blessed in my life. I'm very healthy up until now, but there's people that you meet where they become their medical condition, and you see it in the same way as people become their injury. And often that's because they have gone down this pathway of being over medicalized, and their whole life they've been told that they don't have good knees or they don't have a good back, and it's always going to be a problem, and it's just going to keep getting worse. Like, mate, I've treated people who have literally no sinister findings on their back, and they truly believe that one day they're going to be in a wheelchair because they're just going to break down and eventually they can't walk. And unfortunately, the people to blame for that is oftentimes medical professionals, which is really sad. We call that iatrogenic disability, where the false narratives that people have been given by their medical professionals, whether they be chiros, physios, orthopedic surgeons, physicians, no one is exempt. It happens all the time, and unfortunately, people have just been sold this narrative that they're broken and that they're just going to keep getting worse. And it's really hard to help those people. As you're a coach. The hardest client to help is the one that doesn't think they can do it, because self-belief is so important. So if someone doesn't think they're going to get better, very, very hard to get them better.
Yeah, like one of my first personal training clients, I was working in the gym back in the day. Like, he's getting strong, deadlifting, squatting, like, he's like, hitting some really nice numbers. And he went on the weekend away and he got like a sports massage. And when he came back from sports massage, he like had his back injured. His back went in him, like just from the massage, right? Whatever the fucking masseuse is doing. But then eventually he couldn't train me anymore because his back was gone. He went to the physio to get it looked at. And his physio was like, we're going to have to get you to go in for MRI. He had like, disc degeneration, like, which you would expect in somebody who's aging, right? And then essentially went to the physio after that, and they said, yeah, it looks like you're not going to be able to lift a barbell or machines ever again. He gave him essentially a plan to strengthen his glutes with unloaded glute bridges, and that was it. That was the progression plan. And yeah, he stopped training with me, and he stopped lifting weights altogether for like 2 years. And he texted me like after that, he's like, he's miserable. He wanted to get back in training, but he couldn't. And essentially, all it took for him to actually start doing again was me telling him that he's not broken. Like, if his body's still living, there should be some adaptation that he can be making in terms of like strength, those ligaments, the bones, disc, whatever like that, getting better over time once he's smart with like gradually progressing everything. And he's got back into the gym and he's happier than ever. And it's like, that 2-year gap didn't need to happen. Just from, as you were saying there, just like an unhelpful conversation.
That's it, man. And sometimes it's hard, right? Like, some of these healthcare professionals, unfortunately, are doing this in a malicious way. Like, there are certainly physios and chiropractors out there who are, telling patients a narrative that they are fragile and that they need regular upkeep, often in the form of manual therapy and hands-on treatment. There are for sure people who are saying, hey, I need to see you once every couple of weeks if we're going to keep this on track. And, you flared up. You know why? That's because you haven't been in a month. For sure. Those bad actors are out there. But sometimes it's just people not knowing any better. And sometimes there are some physios and chiropractors who potentially just have a view of the human body that is a little bit pessimistic. They think people are fragile, and they're not telling people these things as a way to, beat them down or make them reliant on their services. They just truly don't know any better. And once again, that's where it's up to clinicians to educate themselves, because all you have to do is, there's this huge paper, Brinjikji et al. It's a lot of physios do know it very well, and they basically looked at all of these MRIs in the lower spine, and it's of a pain-free population. So these are asymptomatic patients, and when you look at the percentages of pain-free people that have things like disc degeneration, facet arthritis, even disc bulges, I mean, one, it's way more than you'd expect, and it also just all goes up by age. And I guess that's where you have this more, meta argument about, changes on MRIs and changes on X-rays. Is it the sign of pathology or disease, or is it just the sign of aging? There's a lot of nuance there, and that's probably a discussion on its own. But yeah, it's really important to empower patients and be optimistic and reassure them that, hey, it doesn't really matter what your scan says. If there's nothing nasty, let's get you moving, let's get you training. Because I, for one, believe, mate, I'm still yet to be convinced that there is a single human being out there that wouldn't benefit from resistance training. I just don't think that's a reality.
Yeah. I think when you look at a lot of high-level athletes as well, like a lot of them are very much putting themselves in the way of injury on any given day when they're training, right? Because they're pushing the limits of what they can perform to. And of course, they could have the best recovery in the world, but if you're pushing your body to 100% and you want to get to 101%, sometimes things got to give. And you see this all the time in the likes of powerlifting, for example. There is the odd time, like there's the freak accidents that happen on the platform. Like there's guys who rupture quads and stuff like that. And these things don't happen all that often, right? But quite often you see these guys and they come back. And, these are guys who could be like incapacitated in a wheelchair, and just through the exact same recovery process that you'd probably bring somebody in who has like tendonitis or something like that, like obviously to a more extreme degree, right? But just through this gradual progression of do what they can, could be like getting back to walking, could be back to like getting into do bodyweight squat again, whatever it may be. They're able to scale back up to where they were before. You know, I was competing at a powerlifting competition there in April, and this exact type of thing happened to one of the guys who's competing there. You probably have seen him on Instagram, Gin Jerky Lease, Ken Cooper. He'd train with like John Hack and those guys. But essentially, a couple of years back, both of his quads ruptured on the platform, and then at the competition in April, he squatted a PB, you know, over 400 kilos. And again, this is just through the same process of gradually increasing loading over time and doing what he could, but not telling himself that he couldn't do it. And that kind of ties back into like the self-belief aspect, whereas that happens to, even to a lesser degree, happens to somebody else on a leg press or something like that, or they're doing a squat. Maybe they just twist their knee or something like that, and they just tell themselves, can't do that exercise again. That's a bad one for me. You know, it's the exercise. It's not to do anything else. And as a result, they stop training or even worse. So, like, I guess one thing I would kind of like to ask you on here is, what would be a tier list of training variables to look at when you're managing an injury? So, you know, probably managing load is probably one of the kind of big things. But if I have like an acute injury pop up today, say for example, my lat is feeling a bit kind of off, has a bit of a twinge in it, what would be some of the kind of first variables to adjust within my training so I can continue getting some load in?
Yeah, absolutely, man. So I think in general, you know, when we look at injury, the total training load is very relevant as far as like how much training someone's doing, the load, the volume. I'd say that's probably more where you start with people as to trying to think about, you know, why the injury has come on. And like I was saying before, I don't go into that ad nauseum, but it is one of the big factors. You know, if someone is just chronically doing too much, they're going to kind of have these niggles that come on. And it's one of those where you can't recover your way out. You know, you can do all of the fancy modalities, but if you're just doing too much and like underfueling and undersleeping, there's essentially no way back from that. But if we've identified that, okay, we've got a bit of an active injury, the pain that's associated with it is impairing our ability to perform, there's a lot of levers we can pull on. And I think that's why with bodybuilding, it takes something pretty serious to put someone out altogether. And even the instances of that quite rare. Like I treat a lot of bodybuilders and it's quite rare that someone comes in with an acute injury. Usually it's more that gradual onset. My knee, my shoulder, it's just been gradually getting worse for a few weeks. And those are a lot easier to treat because we're talking more about irritation as opposed to damage in those circumstances. But if we've identified that something is a bit of an issue, we can then start to formulate, okay, well, what levers can we pull on? And I think the first thing is going to be load. And that's usually going to be the culprit for most people because usually they might say, oh, well, my warm-up sets feel okay, but once I get to my top-end weight, I really start to feel that is quite painful. And I suppose we can see that makes a lot of sense. You know, whatever tissue is irritated, let's say it's one of the rotator cuff tendons in your shoulder, you know, when you're warming up with the 30s on the dumbbell bench, those tissues can tolerate that load just fine. But if we get to 50, now that load is putting a bit too much strain on those tissues, and because they're irritable, it doesn't like it. So that's one lever we can pull on. Okay, well, if I can get to full range of motion with the 30s and it feels okay, let's do as many reps as we can with the 30s to make it a hard set. Or maybe we're also playing around with things like pauses. Maybe we're doing some integrated partials. Maybe we're really slowing down the tempo. So a little rule of thumb that I tend to use with my bodybuilders is let's find the weight that is tolerable for the tissue and do whatever we need to do with that weight to make it a hard set. So I think that can be something that a lot of people can take into their training, and it helps you manage these injuries on the fly. Another thing might be the range of motion. So let's say someone was, I don't know, frolicking around the beach and they twisted their knee a little bit. Doesn't seem like anything serious, but it's a bit sore when they lock out their knee into full extension. Maybe that week on the leg extension, they're intentionally not going to full lockout so that they can still get some good stimulus for their quads, but they're not irritating the joint by getting it into that fully closed position. So the range of motion and the loading are going to be the big ones. But I suppose intensity is sort of baked in with that as well, because there will be some people where if they take a light load all the way to failure, it still brings on the pain. And in those instances, sometimes it's also a matter of biting the bullet and either staying further away from failure for that exercise or picking a different exercise that just loads the tissue in a slightly different way.
Yeah, I think that final part there where you said like just like going with a slightly different exercise is something that obviously bodybuilders have, like bodybuilders and people who just train for general like muscle gain, right? You don't have to stick to a specific movement, like compared to the powerlifter who's like, I need to squat, bench, or deadlift to do my sport, right? Whereas bodybuilders, we do have like the choice there. And I think like even the context where you were talking about like the person who's twisted their knee, leg extension, that's maybe going to be a harder one to not going to get to maybe full extension with, because it pretty much the load is going to pick up for most machines at that like full range of extension. Whereas the likes of a leg press might be a lot easier to do, right? You can definitely do a little bit more of a softer lockout there at the knee, and that won't cause as much issue. So like, and then even just depending on other gyms, other machines that you have in your gym, that maybe you can alter resistance profiles. For example, like if we're kind of keeping the example of the lat that I talked about earlier, like if you had like a prime machine, for example, and you notice that when you're kind of getting into that like kind of deep stretch position, that's where you're kind of noticing the most amount of pain. All right, let's not load that peg and let's try to load more of the kind of shortened position where you're able to kind of get a little bit more reps in, get a little bit more blood flow into the area, and still like train the target muscle. Like, because I guess like once you're getting some stimulus in, of course, like while it would be ideal in every scenario to be able to push our sets close to failure, if it's a case of just like managing the injury so you can get back to pushing to failure, but still giving it a little bit of love, you're probably not going to atrophy, you know, if you're still kind of giving it some attention there, versus giving it none, and then all of a sudden now strength starts to regress, and the actual adaptation process doesn't also kick in because you're just leaving the area to its own devices. So I guess that's a kind of follow on from that. At what point do we say, for example, we have a niggle pop up? At what point do we say, okay, rest is needed? And then at what point do we say, okay, now we need to actually start kind of training the area?
Yeah, so I think a lot of the time, the severity of someone's pain is basically going to decide that for us. Because in some cases, if we use the example of lower back pain, for example, I mean, you'll have people that come in and they can hardly walk. You know, sometimes even if it's not a serious injury, the pain can be so severe that someone's really struggling to move. So if someone came into me and there was no sign of really serious injury, but they just had this really acute, severe pain, I would probably say to them, mate, if you're struggling to walk around to do your day-to-day tasks, it's probably a good idea to have a few days off the gym, because you just moving between sets and getting yourself to the gym is going to be painful enough, and you're probably best off chilling at home, taking it easy for a few days. But importantly, it's not complete rest. Because even if I was, let's say someone came in on a Thursday, they've tweaked their back, and I said, hey, I'll see you again on Monday, but I want you to have the rest of the week off. That is not me putting them on bed rest for 4 days. I would be giving them some gentle stretches to work on. I'd be encouraging them to either do some little walks around the house or get out for some walks if they could. So movement is still really important. It's never complete rest. But in that sense, do I want them resting from weight training? Yes, because in their current state, that is just going to irritate them too much. Now, once let's say they come back in on that Monday and they're like, oh man, like the pain is still there, but I can move around a lot easier. Okay, sweet. They can get into the gym. Let's maybe start them off with a little bit of arms and delts. If they tolerate that well, let's maybe go to like some back supported and chest supported upper body work. Once we're tolerating that, okay, sweet. Let's start to explore some leg training again. So oftentimes we use a combination of time-based rehab and criteria-based rehab. And both are important, because time-based, it is important if we think we've done some tissue damage, and we do want to allow the body to actually heal if we think we've torn a muscle or a ligament or something like that. But we also don't want to just run out the clock and tell someone to go back to the gym. We want to meet little bits of criteria along the way so that when we do upgrade them to the next step, they're actually ready for it. So yes, there will be times where people do need to rest and all they're doing is some physio stretches, some gentle walks, and spending time in positions that don't cause a lot of pain. In really severe circumstances, that is a good idea, but it is very, very rare that you would tell someone to not move something at all. The only times you would tell them that is if you were worried that they had done some really serious structural damage. And to be honest, if they had done that, you're probably getting them off for some pretty, urgent imaging. So they're being passed along to someone like a physician or someone else at the hospital at that point as well.
Yeah, of course, as you can mention, there's a scale of how intense the injury is going to be. So that's going to very much dictate the response. Like obviously somebody with tendonitis, they're going to have a different approach to somebody who has the very, very severe lower back pain coming into the gym. And I guess like we already talked about, like what that person could acutely do in regards to like the tier list of like training variables to like potentially help them manage the injury going forward. I guess like one thing that people ask here is like, okay, well, I have these like tiered list of variables here. I know that maybe I should take some time off, maybe shouldn't take too much time off. But is there any extra things I could be doing? Is there any like specific recovery modalities that might help? Would going into the physio and getting a rub help? Would my Theragun work? These kind of things. What would your kind of opinions be on like just like the typical recovery modalities that people use to help to get like less injured or to recover?
Yeah, and I think once again, mate, like especially when I'm talking to bodybuilders, I like to frame this in a way that they'll understand, and I use the idea of training and nutrition because in the same way as training and nutrition, injury management is no different. There's some basics, and then there's heaps of other little stuff we can get into. So in the same way, if someone had no idea how to track macros, you're not going to be lecturing them about protein timing or micronutrients or, like fiber nuances and stuff like that. In the same sense, if a kid didn't know how to even push to, like 5 RIR, if they're always below that, you wouldn't be worrying about length and partials and prime equipment and where to load the pegs and stuff. Yeah. So we always have to come into this as focusing on the basics first. And for me, injury management, and I say management as opposed to prevention, because I think prevention is too strong a word. We can't prevent injury because that is an absolute term. So when it comes to injury management, for me, the 3 most important pillars are going to be total training load, which I alluded to earlier, sleep, and that, like I said, there's no way around that. And then just general fueling and recovering through nutrition and things of that nature. Because if someone is underfueled, they're going to be more susceptible. So if those 3 things are in check, which they have to be if we're going to do a good job of this, then yes, there's other nuances we can get into. I know AJ loves his boots that he wears. I know there's other people who love saunas, ice baths. Well, ice baths for bodybuilders, probably not a great idea just because it interferes with that inflammatory response, so we can leave that to the side. But there's heaps of things you can do, right? Now, I guess the most important thing to recognize is that if someone gets a benefit from something and it's not harming them, I don't care. If they're willing to spend the money and the time and they get some benefit out of it, I don't mind at all. And people say, oh, well, is it just placebo? Everything's placebo, in my opinion. Because if I tell a patient that I'm going to give them some exercises which should help them, I've already instigated a placebo because they are going into it with a positive expectation of, oh, well, the physio said it's going to help. So placebo, yeah, rah, but everything has an element of placebo. But ultimately, if the individual is willing to spend the time and the money and it's not providing any negative, and importantly, the other important thing with that is that, yes, we don't want it providing a negative, but we also don't want it taking away from their attention of the important stuff. And that's where, as you called it, getting a rub from the physio, that's where there's this interesting dynamic between those factors. Because manual therapy, it can be this hotly contested topic in the world of injury management. And there's times where it can be really useful. So I don't know if you've ever like woken up with like a really sore neck and you can barely move it. We tend to call it like a wry neck. In those instances, if you give someone like a decent neck rub, they feel so much better when they walk out, and then within a couple days, they're normally better. So if I was really high and mighty physio and I go, oh no, no manual therapy, hands off, only exercise, that person is probably not going to come back in the future because I could have made them feel a lot better then and there. So yes, there's times when manual therapy is effective, but there's other times where people rely on manual therapy or they think it's more important than it is, and it takes their attention away from the stuff that they should be doing. So for example, if someone just thinks, oh, I'm just going to go get the physio to treat my back, but they're not doing any of their own exercise or mobility, they're managing their training variables really poorly, they're not focusing on their sleep or the nutrition because they think, oh, well, the physio will just fix me. In that instance, indirectly, the manual therapy is having a negative effect. So it's always important we got the big rocks in place first. But then, if they're in place and you like going for a massage every so often, you like your Normatec boots, you like your sauna, this stuff is fine, but we just have to recognize that these are the sprinkles on top. They're not the most important ingredients for the recovery cake, so to speak.
Yeah, the 1%. I think, as you kind of mentioned, like the likes of your sleep, your nutrition, your load management, they're going to be the most important things. And I guess you do see people who, for better or for worse, they train like maniacs, and their main recovery strategy is like manual therapy, like just going in, just getting broken up by the physio. I'm sure you've seen the pages of people coming in, going into like a manual therapy session, and it just looks like they're getting the shit kicked out of them.
Yeah, and mate, insane. I sort of have like I've got like a 2-part gripe with those. The first, and this is something as well that I think the manual therapy crowd needs to work on better, is like you need to be honest about what you're doing. And that sometimes really frustrates me when I see these manual therapy gurus and they're telling people that they're realigning muscle fibers, breaking down fascia. When it comes to chiropractors, some of them still think that they're, realigning the spine or correcting subluxations. That theory has been debunked for decades now. So I think if you're going to do some manual therapy for a patient, be honest about what you're doing. And what you're doing is you're not actually treating the tissues as much as you're treating the nervous system. And that's what a lot of it comes down to. We're desensitizing the nervous system, because if we feel a bit of pain through a tissue, but then that pain subsides quite quickly, the brain goes, oh, that wasn't so bad. I'm actually feeling a bit better to move this. But we're not resetting anything. We're not realigning anything. We're not even like loosening anything up. Like, that's the common term. Like, oh, I wish the physio would just loosen my back up. Yes, it feels looser and easier to move, but it's because your pain system has been desensitized. It's not because those muscles have been physically changed in any way. So I think that's important. Like, the narrative needs to be right, because sometimes if the patient thinks that the physio is able to, reset their spine, then of course they're going to think their spine is fragile because it's falling out of place, all the time. So I think that's a really important thing. Our language does matter, and the language we use around our treatment is going to impact how your patient thinks about it. But like you said as well, like these people who are just hammering themselves and relying on, these recovery modalities to, put themselves together. It's just, at some point, it's not, that too is going to not be sufficient to manage their issue. The rubber meets the road eventually. You can only redline it so long before your weekly massage is not going to be enough. So I think it's important to have those primary variables in place.
Yeah, I laughed there when you said like spine fall out in place. It's no wonder that when we're actually lifting weights, we just don't just like collapse instantly underneath a loaded bar. If one's hands can change the formation of our tissue and the position of bones, yet it is very much an interesting one. Like I've gotten a handful of sports massages over the years, mainly during prep and just to relax, if I'm being completely honest. I know there is a whole side of like the bodybuilding industry where it's like come into me for your manual therapy session, and we will like help make your lats look wider, or like, you know, release the knots, and like, you know, that's going to help you present better on stage. And I don't know, from your perspective, like how does that work? Like, because I don't know, because you do see people who to go in for a session, and then all of a sudden they're able to, yeah, like the most common ones, like they're able to, like, you know, spread out their back a little bit more. Like, is that just again the kind of nervous system being like treated again, or what's going on there?
100%, man. You hit the nail on the head. Like, and I'm not going to argue with the results,
Yeah,
because at the end of the day, I've
the
seen
result was
pictures
good.
where, you know, yeah, if the person has enough muscle tissue, like I don't know if my lats would look any different, mate, because there's not enough lat there for my liking. But like you see some of these IFBB pros where you can see, okay, yeah, that side is actually out more now. But once again, is it because they've manipulated the fascia and the muscle and allowed it to like somehow protrude more? No, it's because they've desensitized the nervous system, and the athlete is just able to access that range of motion or that position because it's no longer being inhibited by pain or stiffness. So I think once again, I'm not against people getting these treatments done, because for some people it might be really important. Like hell, if I'm Derek Lunsford, I'm going to
Yeah,
pay this guy $100 an hour so that he can help me get this lat out, because I'm about to go against Samson for 500 Gs. Like, I'm leaving no stone unturned. And even like like a friend of mine, Daniel Yates, he's also on BDU. He got a bit of like the scraping done before his last show. He found that it was really a nice way to like recover at the end of the week. He felt like his body was just like a little bit tighter, and whether that's from him just being able to relax for a little bit and drop some stress, that's probably a big part of it. Now, the scraping and like the really intense ones that you alluded to earlier, my opinion is that manual therapy only needs to be mildly uncomfortable. I don't think that getting people to high amounts of pain is useful, because at the end of the day, I don't want someone in any more pain during manual therapy as I want them doing their physio exercises. So when I give someone some exercises, I tell them, and I say this like 100 times a day, so it rolls off the tongue. I say, I want the pain to be tolerable and I want it to settle quickly. If that's fine, cool, we're in a good range. It's the same thing when I'm treating someone, because I still, you know, do some manual therapy every now and again, and I say to them, hey, it's okay if this is a little bit painful, but I want it to be tolerable. You will never see a patient in my room screaming and writhing around on the table, because I'm never going to treat someone who's that hard and bring on that amount of pain, because I just don't think there's any point to doing it. Now, some people do want like a really firm treatment and whatever, but usually if they're expecting that, they're going to be able to put up with a little bit more. So when I see these videos of people that are literally like being held down by some other guy as some dude, you know, like lays into their calf and they're in absolute agony, I think that is so ridiculous and so unnecessary. And anyone who thinks otherwise, I think, is selling themselves a false bill of goods.
yeah. If that's the type of stuff that they're willing to put up on social media, God knows what's going on in the bedroom. That's it. Some pretty heinous stuff going on. But yeah, I think you touched on like some really good points there. Like, obviously, manual therapy, it's a tool in the physio's toolkit, right? Like, it is helpful in many circumstances. It's the exact same as like, it's the tool as much as you prescribe an exercise, you prescribe a reassurance. Some people might be coming into the physio and having that as the expectation of something that's included in the process. And if you say, oh no, this is not included in the process, all of this other stuff is way more effective and it will actually help you, they might decide that they're going to go somewhere else, and then they don't get the treatment they need. Whereas, as you said, like the communication of what you're going to do, how it's going to help them, yada, 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 alongside the beneficial stuff, it's going to give them a bit of what they want, but also what they need, right? Because, like, again, nobody's coming into the physio's office and being put back together and then leaving brand new, right? It's like the body doesn't like recover and adapt like that. So it obviously is a very useful part of the actual kind of process. Also, one part that you mentioned when you're talking about the posing, and does kind of make sense, is like, you know, if somebody has a particularly overdeveloped body part or overactive body part, you know, so say for example in the back, it's very common for maybe somebody, if their lats are not developed, their arms are bigger. If they've less developed arms, maybe their back is bigger, something like that. And then all of a sudden, you kind of see their physique. Maybe they look a bit locked up, wherever like that. And then just giving that little bit of touch sensation to the area that just allows them to, connect with an area that they might not have been able to connect with before, right? And maybe that just kind of allows a little bit more kind of like relaxation of the muscles or whatever like that. I don't know. I'm just kind of spitballing this idea here. But sounds like it makes sense to me. Whether it makes sense to you or not,
no,
that's a different situation.
Yeah, no, for sure, man. And it's in the same way as like, we sort of know when it comes to like, let's say someone plays football and they get their ankle strapped. Now, is that ankle strapping, like, is that tape really going to stop them from like rolling their ankle, potentially breaking their ankle or straining a ligament? No. Like, if there's enough force going through, they're going to roll that ankle no matter what. But people feel better when they've got the ankle tape on, particularly if they've just, had a recent ankle injury. And it all comes back to like that neural input because the tape is on the skin, there's compression around the joint. So all of the receptors in the skin, the muscle, the ligaments, the joint, they're feeding even more back to the brain because they've got more input coming in. And that makes things feel better. It's very much the same with knee sleeves, very much the same with elbow sleeves. And to your point about the expectations of patients, it's a really big thing to consider. And it's something that I had to come to terms with and learn a lot when I was starting off as a physio. And I think what I've realized is that it's very rare that people come in and they are absolutely adamant that they want someone to put their hands on them and treat them. Now, there are some people who are like that. And it's this dance between me and the patient of, I'm trying to satisfy what they want because ultimately they may just go somewhere else. But I'm also drip feeding in what they need. And sometimes you do have to, give them the win, give them a little bit of a 10-minute back rub at the end. But then because they've gotten a little bit of what they wanted, maybe that means they're going to be a bit more adherent with their exercises. So that definitely is a thing. But I think that ultimately, when you look at the research on this stuff as well, patients aren't really like, adamant, I have to go get some manual therapy. A lot of the time they want a thorough diagnosis. They want, I'll say that again. They want a clinician to listen to them. That's like the main thing. They want to feel heard and they want to feel like they've been given the time and space to actually tell their story. They want, a bit of a prognosis and maybe a diagnosis as well. Like, what's going on? How long is this going to take? Am I going to be okay? And they just want like a coherent plan. And sometimes I'll tell people, I had a guy come in with some, subacute low back pain not long ago. He said he'd been to the massage therapist a couple times. Nothing seems to be helping. And I said to him, I was like, mate, look, at the end of the day, your massage therapist is probably better than I am at massaging it. There's nothing magical that I'm going to do with my, university degree physio hands that's going to somehow fix you more than the other thing. But what was the one thing he hadn't done yet? He hadn't really incorporated, any modifications to his activity. He was still, lifting, heaps of like weight on a job site, like he's a chippy or a carpenter for the non-Australian listeners. Got to watch myself there. And then he also wasn't doing any additional mobility or stretching that may have helped to desensitize his back. So I did not lay a hand on him. We went through some exercises. By the time we left the gym, he said, man, I can tell why those would be helpful. Like, this already feels a bit better. So all he needed was reassurance, a couple tweaks to his day-to-day tasks just while he's a bit more sensitive, and a few exercises. No hands-on, and within a couple weeks he was sweet, and he doesn't need to come back anymore because he's going well. So even in that instance, when I was a younger physio, in that instance I would have thought, okay, well, it's still technically acute pain. Let's get in there and let's do something so I can make him like me. But if you can explain to someone why you're doing what you're doing and they can see that you're giving this some thought, then, people are coming to you because you're, I guess, I hate to use this word, but an expert in that regard. So if you can instill confidence and you can show them that the plan makes sense, they're normally pretty happy to go with the flow.
That's a really good point there. And I guess it's probably something that's a lot more common now that like there's more online physio that's taking place. Do you do online physio or is it just simply like in person?
I do a little bit of telehealth. I wouldn't say it's much. Like some weeks I'll have like 3. There'll also be like maybe a month where I don't have any. So the main people that I see for telehealth are bodybuilders usually, because there's some of the online coaches where their client might live 2 hours away and, you know, they want to refer them for some advice. And honestly, man, like, there's some injuries where whether it was telehealth or in person, it would make no difference because the primary intervention is advice, education, and exercise. And, you know, if someone's got a phone or a laptop, I can just get them to do what I would get them to do in the gym. So yeah, I don't do a ton of telehealth, but when I do, the results are often very, very similar, if I'm being honest.
Yeah, the reason I ask is because it's something that has become a lot more popular in like recent times, right? And I think it's kind of similar to, you know, an online coach. You know, back in the day, going to a personal trainer or coach was, you come into the gym with me and I put you through 3 sets of 10 on squats. Whereas like now, obviously, it's completely changed with the likes of the online paradigm, and it's just like, obviously personal training still exists, like a physio's office still exists, but then there's also just like the more availability of people being able to provide a service online. And because, you know, coming to a physio's office, sometimes there's the hassle of getting there. Maybe the actual physio doesn't have an appointment, or maybe you know somebody like, you know, like yourself or another physio in the area that they follow online or whatever, and they want to get services from them because they like the way they seem like they conduct themselves and the way they provide their services. And it just kind of opens up other avenues where I think there's obviously still people that are stuck in the kind of, if I want a personal trainer, I have to go to the gym versus go online, and still probably the likes of that with physio, probably a bit more in older populations, because they're like, how the fuck is how is he gonna fix my back if he's sitting behind the screen? You know?
Yeah, no, for sure, man. And there's sometimes, and we'll joke about it at work between me and a couple of the boys sometimes, like, for some people, the word physio, you know, it means like, they use it in a way that it like denotes hands-on treatment. Like, I've literally had a patient say to me like, yeah, I was hoping you could just do some physio on me. So to them, physio is, I've got an elbow in your back or in your glute or something. And man, like, yeah, you hear that, like, oh, can you do a bit of physio? And you're like, far out. Like, I've spent 4 years at uni. I'm trying to unravel the complexities of pain and the human condition. And this person's like, yeah, mate, just do a bit of physio. Like, stick that elbow into my glute. So that always hurts a little bit. It's kind of like the equivalent of like a client being like, yeah, bro, I'm not trying to get too big. Like, I just want to look like you. And you've been training for like 10 years. Like, I think that's a similar vibe.
Yeah, very much so. God. Yeah. But I guess I think as we kind of progress across the next couple of years, I think it's going to become way more like, I think like access to either medical care, physio treatment is going to just be way more the norm of getting it online. Because even in the States now, you see, obviously there's so many like medical type sites up and running over there. Obviously some are shams, but some look like they're pretty decently kind of like client centered or patient centered, wherever like that. But yeah, I think it's a good advancement for the industry, because I remember when I would have been getting maybe small injuries back in the day, I didn't realize that like online physio was a thing. I just completely avoided going to physio because I'd heard of horror stories. You know, I didn't want to go in and feel as if I was like I didn't want to feel as if I was coming in with something wrong with me and a patient, and potentially having some like, you know, negative thoughts be put in my head. I don't necessarily do too well with authority, if I'm being completely honest. So if somebody's just like, you know, kind of barking in my ear, I wouldn't do too well with that. But I guess it kind of like comes on to probably what's going to be like one of my final questions here. So like, when is seeing a physio needed versus like when can you just like go about self-managing your injury? Because we talk about like a lot of different management strategies we do here. So what would your kind of thoughts on that be?
Yeah, for sure, man. And I'll be a bit self-serving for a sec, but I recently did an episode on my podcast, and it's called How to Be Your Own Physio. So for a real deep dive on this stuff, I'd encourage people to listen to that. But I reckon there's a lot of instances where, you know, people can manage quite well on their own, and there's a lot of really simple things that you can do before it would be necessary to see a physio. Now, the two exceptions of that, I think, would be the first being if you have had a very obvious acute injury where it is very clear that you've done some sort of damage. I think it's better to get those things assessed sooner rather than later. So if you've, you know, done an SLDL off the floor and you felt a sharp pain and pop in your lower back and you can barely walk, you should probably go get that checked out sooner rather than later. Now, oftentimes, I'm once again biased, but going to a physio, if you're able to go to a physio without needing a referral from like your general physician, I tend to think that's a good idea, because often the physician is either going to send you for an unnecessary scan, that's me generalizing, or they're just going to send you to the physio anyway. So if you live, somewhere where you're able to see a physio as a, primary practitioner, I think that's a good idea if you're going to someone that you know and trust. So serious acute injuries where there's been obvious damage, good to go get assessed as soon as you can. The other time I think it's good to maybe not just wait and see is if the pain is a little bit unusual and it's a little bit suspicious in its nature. So this would be the sort of pain that has been lingering over time with no apparent reason. And the key thing is it just doesn't feel like there's anything that makes it better or worse. And it just is kind of there to a degree all the time. That is sometimes a bit of a red flag, because if we can't reproduce the pain with any movement or any poking or prodding, particularly if it's in an area like the abdomen or the thorax, that does ring the alarm bells of like, oh, well, is there something more sinister that's causing this pain? Particularly if it is, corresponding with other symptoms like unexplained weight loss or, general fatigue. That's stuff that you should go to your doctor about. But everything else, more mild pain that has just gradually come on and is associated with a specific movement or task, once again, we can keep an eye on those things and you can have a crack on your own before you go to a physio. And so I would basically just direct people to the portion that we were talking about earlier. Find the load that is tolerable, do what you need to do with that load to make it a productive set, change around your range of motion if needed, perhaps select a different exercise if needed. All of those things are good self-management strategies. And I would say the point at which you may consider going to see someone a bit more officially, if you've given it 2 to 3 weeks of trying to manage it on your own and it's no better or it's gotten worse, then that's probably a good time to go consult someone, because that is also valuable information. Because if the physio knows that you've sort of done the right thing for these first 2 to 3 weeks and there's been 0 to no change, then that might help them steer in a certain direction and it can kind of get the ball moving a bit quicker.
Yeah, but expedites the process a little bit more, because they are already, they don't have to tell you, okay, have you already done these things? And then they say, okay, we'll go back and apply them. You've already done them. So yeah, that makes a lot of sense. And yeah, I think this conversation can be very, very valuable for a lot of people, because I know like there's not a single client that there's definitely a single client that I work with, but like pain always pops up at some point. Like, some little injury pops up, whether that is, there's a back twinge that happens, whether that's a little bit of knee pain comes in, a little bit of tendonitis. Like it's as part of the process of gaining muscle, gaining strength as the training is, really. Like, obviously you're not trying to seek it out, but as you kind of talked about earlier, if you're pushing your body to its limits, you're trying to push for adaptation. Sometimes you just go a little bit too far above where you're able to adapt from, and these things pop up. But as I always say to my clients, I'd much prefer that little bit of risk than, the opposite of being small, weak, and probably getting pain anyway.
Exactly right, mate. You may as well be beaten up and jacked than small and probably still in pain. But no, I actually think there's a lot of wisdom to what you said there, and it's something I find myself telling a lot of people, especially people that have had sort of a complicated relationship with pain. And I think this is maybe a good place to, a nice bow to tie onto the conversation, is that pain is normal. Pain is a normal part of the human experience, just like hunger is a normal part of the human experience. And, periods of feeling a little bit of low mood, these things are normal. And the reason why pain is normal and important is because it is a protector. It helps us to stay out of trouble for the most part. The thing is that there's just times where pain is more helpful and more relevant, and there's other times where it's less helpful and less relevant. So I have never told a patient that I'm going to get them pain-free, because pain-free doesn't exist. Well, it does. It's called dead. So the goal is not to get people pain-free. The goal is to educate them about pain, explain what it means, and help them get to the point where they can manage really well on their own and they're living the life that they want to live. That is actually the end goal. And we just want to get people to the point where their pain is not stopping them doing from what they want to do. Because pain's a normal part of life, and it's just about, accepting and recognizing when a painful episode arises, how we can settle it down, and how we can equip people to move forward.
Excellent. I think that's, as you said, really nice way to wrap up our conversation. And Lars, really thank you very much for coming onto the podcast. I'm sure everybody who is listening to this is going to be far more educated on this topic now, and are going to be able to manage their own little niggles as they pop up. Do you want to let people know where else they can find more about you and like more of your content?
Well, firstly, mate, just thank you for having me on. As a podcast host myself, I know that it's a big deal to invite someone on, and you normally curate it quite closely. So it's an honor to be on. Thank you so much for the opportunity to speak today. If you're interested in myself or anything we've spoken about today, I'm most active on Instagram. So it's @general.muscle, where I'll share a combination of my own journey as a bodybuilder, some coaching related info, some physio related info. But for more deep dives on both physio stuff and bodybuilding stuff, I've got my podcast, which is the General Muscle Podcast, which is out every single Monday. But if you want something a little bit more bodybuilding centric and a little bit more laid back, you can listen to me, Jack Radford Smith, Daniel Yates, and Daniel Chappelle on Bodybuilding Down Under, and that comes out every Wednesday.
Awesome. I'll link all that in the show notes. I've already had Jack on and looking to get DC on pretty soon, so to wrap up his season in the IFBB and everything. Yeah, look, man, I really appreciate you coming on. I'll link everything in the show notes. People at home, if you have enjoyed the episode, obviously go over and follow Lawrence on all of his on his social media. Go listen to BDU podcast for sure. It's a great one. It's a great one for a bit of banter. And if you enjoyed this episode, make sure to leave it a rating on the podcast platform you're listening on, and we will catch you in the next one.